Hi everybody, I'm going to be talking to you today about the flu shot. It's that time of year again. We're entering the flu season, which runs between October and May every year. At this point, I'm sure you have either had the flu yourself or you know somebody who has had the flu or you come in contact with somebody that has had the flu. We are reaching the peak of the flu season, which is between December and February every year. This is the time when the most flu cases are reported every year. During this time, you are certain to come across somebody who has the flu. This is especially true for people like me who work with the public. Every day I come in contact with at least one person who tells me that they're sick. They either have a cold, a cough, or the worst of all, the flu. I have to stand only feet away from these people and help them fill out paperwork, answer questions, and get stuff taken care of. These people are touching pins on my desk. They're touching paperwork that I have to put on my desk. And this doesn't just affect me. This also affects the next customer in line. Either myself or this customer are going to touch something that is infected with the virus that these other people have, and then we're going to take it home to our family members and friends, and we're going to keep spreading the virus. This is how it happens. This is why it's so contagious. I always wonder why these people don't just stay at home, why they have to come out in the public and deal with people like me, who are healthy at this time until we get the flu virus. But I know that that's not always the easiest for people who don't have a choice. They have to come out and take care of their business when they have the opportunity. The problem is the flu is highly, highly contagious. And in some cases, it's very dangerous. Children, the elderly, and those who have health issues are the most at risk when it comes to getting the flu virus. Last flu season, there were 105 reported deaths in children from 30 different states, according to the CDC, that were caused by flu-related viruses. There are many ways to prevent the flu. For starters, you can make sure you wash your hands, especially when you have to go out in public, when you go grocery shopping or you come into like a public office and you touch stuff. Make sure you wash your hands. Make sure you don't touch your face, your nose, or your mouth or your eyes and spread these germs to yourself. You can avoid contact with those you know have the flu. If you know somebody has the flu, try to stay away from them as much as possible. And if you have to be around them, try to stand as far back as possible. Make sure you wash your hands after you've had to come in contact with these people. Just try to prevent spreading the virus from those who are already infected. Those who are infected should stay home as much as they can. Stay home and keep from spreading to those around you, to other family members, friends, and your coworkers. I know a lot of people don't want to miss work, but you're not really, helping when you go to work and then you spread the virus to your coworkers and then they get sick or they get their kids sick and then they have to miss work too. So it's best if you can just stay home as much as possible. But the best way to keep from getting the flu is to get your flu shot. According to the CDC, the flu shot is 60% effective at preventing the flu virus. So when you get that shot, it's 60% effective. That means that you're 60% less likely to get the flu than those who haven't had the flu shot. Of those 105 reported deaths from children that had had the flu last year, 80% of those kids were not fully vaccinated. Getting your flu shot can be a matter of life and death, especially for the elderly, the young, and those who are sick. It is the best way to prevent getting the flu. It is highly recommended by doctors that you get the flu shot. If it is available to you, take it and prevent the flu from spreading any further. Thank you.